10 leading causes of death in older adulthood. Older folks are more susceptible to a range of health issues since aging is a natural process that causes many changes in the body. As people age, a number of illnesses and health issues grow more common, raising the chance of dying. Knowing these factors can aid in early intervention and prevention, which will ultimately increase longevity and quality of life. Here is a detailed explanation of the top 10 causes of death in old age. 1. Heart conditions. The most common cause of death for older adults is heart disease. Weakened heart muscles, clogged arteries, and elevated blood pressure are the causes of conditions like coronary artery disease, heart attacks, and heart failure. Stress, poor diet, and inactivity all contribute to the accumulation of cholesterol in the arteries over time, which narrows blood vessels. The risk of heart disease can be considerably decreased by controlling blood pressure, cholesterol, and leading a healthy lifestyle. 2. Brain attack stroke. A stroke happens when a blood vessel in the brain breaks or when the blood supply to the brain is cut off. Strokes are more common in older persons because of heart disease, diabetes, and high blood pressure. Speech problems, paralysis, or even death can result from a stroke. Preventing stroke can be aided by identifying early signs and managing risk factors such as high blood pressure and cholesterol. 3. Cancer. One of the leading causes of death in old age is cancer. The body's immune system deteriorates with age, making it more difficult to combat aberrant cell proliferation. Elderly people are more likely to develop cancers such as lung, colon, breast, and prostate cancers. A nutritious diet, quitting smoking, and routine health tests can all aid in early identification and prevention. 4th, conditions of the respiratory system. For older adults, chronic respiratory diseases such as asthma, pneumonia, and chronic obstructive pulmonary disease, COPD, pose serious health hazards. Lung function deteriorates with age, and the respiratory system is further harmed by smoking and pollution exposure. If left untreated, these illnesses can cause serious breathing difficulties and even death. Lung health can be maintained by abstaining from smoking and environmental contaminants. 5. Dementia and Alzheimer's disease. Cognitive impairment, disorientation, and progressive memory loss are symptoms of Alzheimer's disease and other types of dementia. Over time, these neurological illnesses deteriorate, resulting in total reliance on caregivers and ultimately death. Although there isn't a cure, regular exercise, a healthy diet, and mental stimulation can all help to reduce the disease's course. 6. Complications of diabetes. Serious side effects include renal failure, heart disease, nerve damage, and infections can arise from long-term diabetes. The body's capacity to control blood sugar levels declines with age, raising the possibility of several issues. Life-threatening consequences can be avoided by regular blood sugar checks, a nutritious diet, and medication compliance. 7. Disorders of the kidneys. Due to long-term harm from diabetes, high blood pressure, and several drugs, chronic kidney disease, CKD, and renal failure are common in older persons. The body accumulates toxins as a result of the kidney's progressive loss of waste filtering capacity. Renal health can be preserved with routine renal function testing and appropriate treatment of underlying diseases. 8. Sepsis and infections. Due to weakened immune systems brought on by aging, older adults are more vulnerable to diseases such as skin infections, urinary tract infections, and pneumonia. Sepsis, a potentially fatal illness in which the body's reaction to an infection damages its own tissues, can result from these infections if they are not treated right away. Infection risk can be decreased by vaccinations and proper personal cleanliness. 9. Fractures and falls. One of the leading causes of harm and mortality among the elderly is falls. Poor balance raises the risk of falls, which can result in fractures and other severe injuries, while conditions like osteoporosis weaken bones. Complications from these injuries may include infections, immobilization, and even death. Fall prevention strategies include calcium consumption, frequent exercise to increase balance, and home safety improvements. 10. Dehydration and malnutrition. Despite being frequently disregarded, malnutrition and dehydration are major causes of death for the elderly. The body becomes weaker due to inadequate food intake caused by neglect, dental difficulties, digestive disorders, or loss of appetite. The body finds it more difficult to heal from diseases or injuries as a result. Maintaining strength and immunity requires eating a balanced diet and drinking enough water. In conclusion, a healthy lifestyle, frequent checkups with the doctor, and early detection can help control or prevent many of the diseases and health disorders that are more likely to occur as people age. A healthy diet, regular exercise, chronic condition management, and mental well-being can all significantly enhance quality of life and lower the risk of dying young. Elderly people's well-being is also greatly influenced by the support and care they receive from family members and other caregivers.